Functional restoration program is essentially a multidisciplinary approach to managing chronic pain. We call that the biopsychosocial model for care, and it is very effective for people. Virtual embodiment training is, to me, the future, one of the centerpieces for the future of chronic pain management. If we are able to capitalize on an ability to unlearn pain behaviors that with chronic pain become embedded in our daily lives, that could be transformational in our defense against chronic pain.
Did you know virtual reality is being used to successfully treat chronic and acute pain? Virtual reality therapy is a 90-day at-home therapy utilizing a virtual reality headset, a licensed telehealth coach, and interactive therapy modules combined with virtual embodiment training to focus on fear avoidance, therapy using the brain's natural neuroplasticity to treat chronic and acute pain. VR therapy is currently covered by workers' compensation, the Veterans Administration for Veterans, and as a cash pay service directly through providers. Clinical studies have shown that virtual reality therapy can reduce opioid consumption, reduce pain, stress, and anxiety, as well as improve sleep behavior by as much as an hour a day. Studies have also shown patients exhibit a significant increase in social and behavioral goals. VR therapy modules are specific to the anatomy and can treat upper extremities, upper and lower back, as well as cervical issues. Indications covered by the program are failed back syndrome, fibromyalgia, frozen shoulder, lower back pain, phantom limb pain, radiculopathy, repetitive strain injuries, sciatica, SI joint dysfunction, spondylolisthesis, and thoracic outlet syndrome. Welcome to Karuna Home Coaching, the leading home virtual reality embodiment training to treat chronic and acute pain through fear avoidance. It is a comprehensive 12-week program designed specifically for patients with chronic pain and acute pain. Who are Karuna coaches? All Karuna coaches are certified by the National Board for Health and Wellness Coaching. They also hold a national provider's number. Karuna coaching addresses fears that lead the patient to avoid activities. The coach guides and supports them to confront the feared activities with graded exposure. Together with the patient, they create a plan to practice these activities without fear. Karuna coaches engage the patient by building a relationship with trust and rapport. They help the patient identify their values and goals. They connect the patient to their motivations. And they create an action plan with the patient. The first coaching session is 90 minutes and is used to gain insight into the patient's history and current functional status. The remaining 11 sessions are 60 minutes and have 3 parts to a typical session. 1. Review the agenda for the session and check in on how their week went. Discuss challenges and celebrate successes. 2. Transition into discussing pain science concepts and behavior skill building. 3. The last part of the session is for discussing and defining the patient's weekly goals. Weekly coaching topics include predictive coding and calming the nervous system, danger alarm systems, pain pathways, and graded exposure, emotions, thoughts, behaviors, stress, and relaxation. Mindfulness and gratitude, enjoyable activities, social connections, restoring life balance, reclaiming your life, planning for success. How does a coach measure progress? The coach can log into Karuna Portal and track their virtual reality activity and improvements in real time. The patient also receives digital, self-reported validated measures to be submitted every 4 weeks. The measurements include FAB-Q, OSOSTRI, PCS, and PSEQ. What are the benefits of Karuna Home Coaching? Patients can return to work, life roles, and activities of daily living. Improve mobility and exercise behaviors. Decrease fear and anxiety, increase social engagement. Improve quality and enjoyment of life. After your physician's approval, there's 5 steps to get started. The patient receives a phone call from their assigned Karuna coach. They activate their patient management account. They schedule an equipment setup session with their coach. They meet with their coach for equipment setup and to get them comfortable with the virtual reality equipment. They'll continue to meet for 12 weeks via telehealth video sessions that are HIPAA compliant.